put out in emails, whatever you do. Yes, we saw him. It's true. Okay. Now, this is from the head trainer of the team, the director of player health. There's no swelling at 72 hours. Gone. Everybody who knows the problem knows that's a 2.5 to 3 week problem. I had it gone. What happens is if you decongest the area, you don't have the downstream problem. So why does that matter? Well, we didn't have the subsequent disuse atrophy. We didn't have the subsequent faulty scarring from lack of motion. We didn't have those problems. And we didn't have the suffocation and killing of otherwise perfectly healthy cells because the congestion wasn't there. Again, it's not secondary cellular death. It's primary to the congestion and the disuse. So you go, oh, well, that's one case. Okay, I have hundreds of those examples. I have a paper called Procrastination, a Fundamental Flaw in Injury Management. My co-author is the editor-in-chief of the Physician and Sports Medicine Journal. Now, if you think I'm a crazy person and I don't know what I'm talking about and I make stuff up, that's fine. Think whatever you want. He's a straight line editor-in-chief of the Physician and Sports Medicine Journal, a mainline orthopedic surgeon. He's saying, look, here's what's true. Here's what I'm doing. The one other story that I really like, this is from, again, I'll tell you offline the person's name. I don't want to say his name over there. I don't think that's fair. But the head trainer for a team sent me an email. He said, Gary, here's what just happened. Athlete had a longitudinal quad tear. Longitudinal quad tear. Measured the blood in the quad with ultrasound. Activated the muscles in and around the damaged site for 6.5 hours. That's where the 6.5 hours came thing. I crossed my stories just then. For 6.5 hours. Following day, measured the blood in the quad with ultrasound. His word. Gone. Period. Turned a 4 to 6 week injury into running in 3 days, playing in the World Championships in 10. Now, if you're thinking to yourself, that doesn't sound possible. The trainer said the same thing to me. He said, Gary, I was shocked at how fast your technology sped up recovery. And I said, it didn't. He said, no, Gary, it's a 4 to 6 week problem. I'm positive how long it takes. I know what just happened. I said, no. That's what happens if you mismanage the patient. Now we know how long it's supposed to take. 3 days running, 10 days playing in the World Championships. Look at what happened. Everybody who's in the business, if you have a longitudinal quad tear, the blood in the quad, you know what it looks like the next day. It's worse than the first day. You know the third day is worse than the second day. So you know what's happening. It's congesting, begetting congestion, getting more swelling, getting less movement with more pain. Now the swelling's down below the kneecap. Now the toes are starting to hurt. They're walking on crutches. They're sitting still. They're icing it. They're compressing it. They're making a mess of the whole situation. That's what happens when you mismanage it. That congestion will suffocate and kill otherwise perfectly healthy cells that were not involved in the initial trauma. That's going to happen. You're going to have faulty scarring from lack of movement. You're going to have disuse atrophy from the lack of activity. And you're going to have elevated myostatin levels, which will prevent the regeneration of the muscle tissue. So all of the things that are going wrong that make it take 4 to 6 weeks aren't the result of the injury. The injury only took 3 days running in 10. It's your mismanagement that drug it out to 4 to 6 weeks. Now, I'm really sorry if that offended anybody, but I'm telling you right now, I don't make stuff up. I'm just stating facts to you. I'm a reporter. That's exactly what the trainer told me, and I've personally seen this literally hundreds of times.
John?
So let's go back to our friend Rick. Is there a place for rest or ice in any other recovery process?
And that question's for me?
Yes.
Yes, sensible rest makes sense. But when I had one doctor say to me one time in a lecture I was giving, well, what do you mean by rest? I said, I'll tell you what, I happen to have the slide. And I popped the slide up that said, it's from the dictionary, from Webster's dictionary, here's the definition of rest. And the definition is you rest, you don't do anything. So yes, you should sleep. Yes, you should not stress the damaged site to the point where it becomes uncomfortable if it elevates your level of discomfort. However, sitting still doing nothing, that's resting, that's wrong. Don't do that. Don't do that. Find a way to activate the muscles in and around the damaged site so you can move the waste through that passive lymphatic system and begin the recapitalizing of the tissue around the damaged site. So no, like if I got hurt, I'd be using our clinical product, H-Wave, or I've had a surgery. I'd have it on basically nonstop post-trauma. For example, I broke my collarbone, a clean mid-shaft fracture a few years ago. All documented. It's in my book, by the way. The doctor's name who treated me is in the book, and the x-rays are available for anybody who wants to see it. I had a clean mid-shaft fracture, and I began activating the muscles in and around the damaged site within an hour of the fracture. And how do I know it was fractured? Well, because I heard it break, and I saw it physically. I felt it with my hand out of place. When I started running again, I had tripped running and fell to the sidewalk and broke it. And by the way, if you never did that, it's really hard to get off the ground when you have a broken collarbone. It's like, okay, I can't go this way, I can't go that way. But I got up, and I realized I was in trouble. And a woman had saw me fall, and she came running over. She said, I called an ambulance. I said, don't call an ambulance, just stop. I'm going back to my hotel, I'll be fine. She said, no. I said, listen, I'm going back. She said, well, I'm not letting you go yourself, I'm going with you. I said, fine, you can run with me if you want, but that's my hotel over there. I was in the Baltimore Harbor, and I could see the Marriott, and I know where I was going. So I started to run. I was still about a mile and a half out. And about 10 steps into the run, I felt it snap and go back into place. And I kind of like, ah. And the woman said, what's wrong? I said, it went back into place. And she said, how do you know? Because I felt it snap back into place. It's way better now than it was a minute ago. So I know it's back into place. So when I got back to the hotel, if this were a long version story, I would tell you how complicated it was to get out of my sweatshirt that was an over-the-head sweatshirt. That is a trip because I got stuck halfway out, and I couldn't decide whether I should go down to the concierge and have him get me out with a pair of scissors or whether I should rip it over my head and just hope for the best. I ripped it over my head and hoped for the best, by the way. But I immediately began activating the muscles in and around the damaged site. I was in the Baltimore Harbor, and my doc was in Philly, so I made an appointment to see him the next day on Monday. I did it on Sunday morning. And when I got to him, he said, so what's up? I said, I broke my collarbone. He said, well, how do you know? I said, well, I felt it snap. I looked, I felt it, I saw it, I felt it go back into place. He said, let's get a picture. So when he got the picture, he came back, he said, see that white line there? That doesn't belong there. And I said, yeah. He said, well, that's a fracture. It's broken right in half. And I said, okay, so what do you think? He said, well, I'm a little surprised because you don't have any swelling and you have almost no pain. I'm really surprised that it's broken. And I said, Doc, I've been activating the muscles in and around the damaged site for 16 and a half of the last 24 hours. Why would there be congestion? I never allowed that 24 inches of angry snow to accumulate. He then looked at me and said, Gary, at our age, we're both in our 60s at the time. He said, you got to be careful that you don't get a frozen shoulder. I said, Doc, I won't get a frozen shoulder. He said, I'm just telling you, it's a common problem with people our age when this happens. I said, don't worry, I won't get one. I didn't tell him at the time, but I had actually started walking my finger up the wall that morning in the shower, so I was already walking my fingers up the wall. And at 6 days post-break, the following Saturday, I had my arm fully extended above my head with only a slight catch about 3/4 of the way up that I had to kind of wiggle to the one side and then get it up. My arm was fully extended above my head 6 days post-break. And everyone that I talked to were like, wow, that's amazing. I said, no, it's not. If you don't allow the accumulation of waste in and around the damaged site, if you don't allow the faulty scarring, if you prevent the disuse atrophy, you don't have the problems that follow all of that situation. And again, if you read my article, Secondary Cellular Death is Actually Negligent Homicide, it's free on my website. Download it, hand it out. You need no rights. Just take it and use it. I have all of the proof and all of the evidence, not from my personal experience, but from the medical literature. And your other question was ice. I'm sorry, the ice one's a lot shorter. I do give an example of when you should use ice. I give 2 examples in my book of when you should use ice. One is a guy by the name of J.C. Santana, who trains a lot of boxers down in Florida, said to me, what if a guy gets popped above the eye in the first round and it's starting to swell? I said, put ice on it. It'll stop the swelling. It doesn't prevent swelling, by the way. It stops it while it's cold. When the tissue rewarms, the inflammatory response resumes and the fluid it comes. But if you do that in a fight, it'll help keep the swelling down while you're fighting. And then another time would be, say you were at an event and a 12-year-old, making up the age, but a 12-year-old dislocates their ankle, and no one there knows how to solve the problem, and the hospital's 45 minutes away. So no one there knows how to relocate it, and you got to go to the hospital. Well, if you're going to ride in a car for 45 minutes and you got a bag of ice, put it on. That'll limit the swelling, maybe even stop the swelling because the cold, if you get it cold enough. And then when you try to relocate, it's a lot easier to relocate it if it isn't swollen. It's just simpler. It's just less painful. It's easier to do. And then on top of that, you'll give the child pain relief while they're on the way to the hospital because it does desensitize the area. So it does lessen your sensation of pain. And then beyond that, when you get to the hospital and they're trying to work on them, the level of fear and anxiety is likely going to be less than if you're riding in the car and the kid was screaming in pain and their ankle swollen for 45 minutes. So yeah, there's a great reason to use it. But that's the only two I can think of. If there's another reason, I'd be happy to add it to my list. But as a general rule, trapping the waste in and around the damaged site and preventing the natural flow of oxygen and supplies is not a good plan.
All right, so Bryce Winter on Twitter had mentioned that with the exception of a couple athletes who insisted on having ice, they got away from using ice at their junior college. And that's one of the other questions is sometimes we use it for that emotional support, like an athlete won't calm down, right? So you got this athlete that's just freaking out, oh my gosh, I'm going to die. I'm gonna die. So, okay, well, let's put some ice on it, and then I'll check you out in 10 minutes, that kind of thing. And so we put the ice on it because that's the only thing that's going to help them calm down so that we can evaluate them and move forward. Is that any different? Is that doing damage by putting that ice on there for a short amount of time, that one time to do the evaluation?
Probably not an issue that matters. Just realize that when you do it, you're delaying the healing process because you're slowing everything down. You're likely increasing swelling because when the tissue becomes cold, it causes a backflow from the lymphatic vessels into interstitial space, so it actually increases swelling. However, as you're describing it, if that were my option and the person calmed down when I gave them the ice, I'd give them the ice and calm them down. However, on the backside of that, I didn't use ice when I fractured my collarbone, and all I did was found the neutral position, and that calmed me down. Once I found a neutral position, there wasn't that much pain, and once I decongested the area, it was all solved. So could I have used ice to calm down? Sure, it would work. It does work. I wouldn't use it more than the one time, and I certainly would have the towels on to prevent any kind of skin or nerve damage as a result of the ice, which is kind of interesting to think about that because everybody is aware of the fact you don't put the ice on top of the skin because it'll kill the skin. Nearly everybody is aware that if you put it on top of a superficial nerve, it'll kill the nerve cells. Nearly everybody is aware of the fact that if you put it on a muscle, it'll destroy the muscle cells. So it's like, okay, you know all these problems exist, yet you still want to do it because you want to calm the person down. I'd rather talk them through it and find a neutral position and begin to decongest the area. But I get the way you described it, and yes, I would do the same thing that you're suggesting under those conditions. However, if I had a choice, which if you don't have tools to do it and you don't have a way to find a neutral position, to get them in a neutral position, or for that matter, an air cast, you got to do what you have to do to calm the person down because that stress, they're liable to flip their arm or twist or jump, or they're liable to hurt themselves more because they're so upset. So yeah, I can go with that. Again, I'm a reporter. I'm just telling you the clinical using the RICE or the RIC protocol, the rest, ice, and compression. I don't think elevation makes a difference one way or the other. I don't think it's good or bad. I think it's just there. But the RIC part, the rest, ice, and compression, just understand the consequence of doing it. Did it calm things down and help you evaluate and make your long-term clinical decisions? In other words, we need to go to the hospital right now. Hey, if that solved that problem, of course, use ice.
All right. A couple years back, I listened to Dr. Mark Merrick, and he said that ice is is beneficial in the first 6 to 12 hours only, but after that, it does delay healing. And so that's actually kind of where I began the journey of not using ice. And so it's again along the same line, is there may be possibly a use for it once to help calm the athlete, to prepare him to move, or, or like you said, if there's a fracture where they're unable to reset that type thing, that situation. But for the most part, we don't use ice, or kind of like Bryce was saying, if a player is insistent, I really want some ice, then what I always do is I say, okay, well, we're going to do these exercises first. And if you finish these exercises, then I can give you some ice. And then that way, if they don't finish them, then they don't get it. And I've kind of accomplished what I wanted to in kind of like a compromise situation. So do you feel like in that situation that I am harming them by giving them that ice, because we've done the movement, we've done the accomplishment, and so now it's more of a mental thing?
I don't like the word harming them, just because I don't want to.
Slowing recovery.
I don't want you're doing a couple things. You're delaying healing, you're increasing swelling, and you're causing additional damage. So, is the damage great? Couple minutes, a towel between the pad, a towel between the ice and the player. Get enough towels between them, very little harm. Very little increased swelling if you have also kept the ice away from them. And the delay in the healing, you do it one time, how big's the delay? It's the chronic ice use that becomes the real issue. Here's what the most ridiculous thing I ever saw. I saw an ice bag on a player in the training room on top of a cast. And when I saw it, I thought it was a joke. I thought they were like messing with me. And I said, "What's with that?" And they said, "Oh, the doc wants some iced after his therapy." And I went, "He's in a cast." And they said, "Yeah, but doc said he wants some iced." Okay. How do I respond? Did that hurt anything? Of course not. And you put ice on someone and you put a towel between them and the ice, and it's on for 8 minutes. What was your depth of penetration? Very slight. Very slight. Did you cause any skin damage? Probably not. If you didn't cause skin damage, it is improbable that you caused deep, serious damage. So a little bit of ice, and you're using it the way you're using it to calm the person down, and you've got enough filters between the ice and the person that it's not really going to impact, who cares? But it didn't work anyway. But by the way, that makes me go back to my big argument against the people who say, "Oh, I need the ice." Okay, read my article, the Cold Hard Facts Weighing the Evidence, and you'll see I gave a list of 15 or so questions. One would be, let's just say it's a deep bone bruise. How cold do you make it? Like, how cold do you have to make it down by the deep bone? How cold? And how do you get it cold down there without destroying the superficial tissue? The answer is you can't. And the fact is it doesn't work, because you could never get it cold enough to affect the deep bone bruise without destroying the superficial tissue. So it couldn't work. But let's just say that you could do this. Somehow you figured out how you could do it. Okay, how cold, what temperature are you trying to get that deep bone bruise to? And is a ligament different than a deep bone bruise? And is a tendon different? And is a superficial muscle, say one of your superficial muscles in your quad area, compared to a deep muscle? So how would you get a deeper quad muscle, say your adductor magnus, whatever, pick your psoas, whatever, one of the deeper ones. How would you get to that without destroying the superficial muscles? Well, the fact is you can't. So even if we agreed that icing was good, it's not, but let's just say we agreed it was good. What's your protocol? What tools are you using to measure? How often do you make it that cold? How do you get it to that temperature without destroying the other tissue in the area? How often do you do it? Now, these are really reasonable questions if we're talking about evidence-based medicine, don't you think? That you should know how cold to make it, how often to make it cold. how you know when you got it to the temperature you're trying to get it to? You do none of these things. Over 40 years of widespread use, and you can't answer any of the most fundamental questions. The fact is, you can't do it. So even if it were a good idea, we have no measurement system whatsoever to determine what temperature you should get the tissue to. By the way, you guys both athletic trainers?
Yes, sir.
Okay. Have you ever measured the temperature in a deep muscle bruise?
No.
Well, then how in the world do you know if you got to the right temperature? And why do you put towels between the skin and the ice bag? Why do you do that? Why do you do it? Why do you put a towel between the skin and the ice?
So you're not damaging the skin.
But doesn't that affect the temperature of the ice coming through the bag?
Correct.
Okay, so how much did you affect it?
Very minimally.
And how cold did you get the tissue?
Exactly.
And is a bone bruise different than a superficial muscle bruise?
Very much so.
And so how do you know which temperature to make the other? And how would you get the deep or cold without destroying the superficial? See, you can't even answer the fundamental basic questions, nor is there a protocol in all of the literature. I've pulled everything. There is no protocol to tell you how to do what I just described. And there never will be, by the way, because you can't do it. There is no way to measure and get it to the temperature. And by the way, there isn't even a written down temperature. You can't even say, oh, well, Dr. Smith says that you should get it to 79 degrees. No, there's nothing. There is nothing. 40 years of widespread use, and you guys don't even have a protocol. I don't mean you guys. I'm saying the profession who follows the Rice protocol. Put ice on it. Oh, okay, great.
All right,
Now what?
real quick, John has one more question, and then he's going to have to jump. So, John?
Yeah, I was looking at the article, the procrastination article. There's the phrase, preserve tissue today rather than regenerate tomorrow. We talk about mismanagement of these injuries. How do we promote that clearly with our athletes?
You're talking about my article, procrastination?
Yes.
Well, the easiest way that I explain it to athletes is, if you mismanage the situation, you will suffocate and kill otherwise perfectly healthy cells that were not involved in the initial trauma. That congestion will lead to faulty scarring and lack of motion, which will lead to disuse atrophy. That will prolong your recovery process. It is easier to preserve than it is to regenerate. So rather than, like I told you the story with the athlete with the longitudinal quad tear, which they ran in 3 days, played in the World Championship in 10 instead of taking 4 to 6 weeks, I just explained it to them. In fact, I use that story very often when I'm talking to athletes. I say, look, here's the reality. If you do what people do traditionally, and I'm saying people who are following the Rice protocol, it's going to take us weeks to get not only regenerating which was damaged from the trauma, but what we're going to lose over time because we're mismanaging it. And I hardly ever have an athlete say, well, I want to make it take longer. That just doesn't happen. So I just explained it to them.
All right. So we've been talking about mismanagement or speed and recovery, or, you said they've been hooking up to the Mark Pro for 6 or 10 hours. So practically in the athletic training room, we talked about ankle pumps, doing healing. So what about other tools that we already have? Kind of before we were talking about manual therapy and how manual therapy is fantastic when there's one athlete per one athletic trainer in the athletic training room, or, that kind of thing. But when they go home or when you're on an airplane or something like that, then it doesn't work. So what are some of the other practical things that we can do inside the athletic training room to help properly manage an injury without using ice?
Start off, use your brain, never cause pain. First rule, I always follow that. Use your brain, never cause pain. And then what you want to do is say, if you're thinking it through and you haven't thought it before, just think it through and say, what's my goal? Your goal is to preserve and regenerate. So you want to preserve tissue. You don't want any more lost as a result of that was lost following the trauma. So you don't want to lose any more. And you want to regenerate that which has been lost. So how's that work? Well, by loading the tissue. You load the tissue, you increase circulation in, you increase circulation out by the lymphatic system, and you cause enough stress, you have to have enough activity that you'll cause the sprouting angiogenesis, and you'll get the increased capillarity to the area. And then because of the movement, because of the activation, you'll prevent the tissue's atrophy. So it all becomes very simple, and anything works. I know it sounds like so old-fashioned, but when coaches told my generation to walk it off, to keep moving, don't sit still, it'll tighten up, they were actually right. Now, unfortunately, they probably had more than one of us walk on a broken ankle, but in general, their idea was right. So when I broke my collarbone, I knew that it would swell if I didn't decongest the area. I knew that would happen. So I immediately began activating the muscles in and around the damaged site. If I didn't have my prescription product with me at the time, my H-Wave, then I would have had to just move my shoulder and flex the muscles in and around the area. It wouldn't have been nearly as good because I would get bored and tired, and I couldn't have done it while I fell asleep. So having a tool that does it electronically really just solves the biggest problem of all, and that's that you won't keep doing it. Like asking the two of you, have you ever done ankle pumps for more than 2 hours?
No.
Okay, do ankle pumps work?
Yes.
Yes.
Did 15 minutes or 10 minutes or 7 minutes, did that solve the problem?
No.
So then why didn't you go for 2 hours?
Because you get bored.
Okay, well, there goes the problem. My machine doesn't get bored. Okay, it doesn't get bored. It activates the muscles in and around the damaged site without making you tired. So, and you don't get bored. So here's the thing. I don't make it bigger, stronger, or prettier. I don't do that. But I'll activate the muscle in and around the damaged site, and we'll decongest it and begin that recapitulation of the tissue around the damaged site. Which, by the way, you could do it on a power plate. You know, the thing you stand on shakes you. Power plate works. Ankle pumps work. Squeezing a ball works. Anything that loads the tissue. There's a great article. It's referenced in all of my articles and in my book called Loading by Buckwalter, 1999. And Buckwalter says something along this line. This isn't an exact quote, but something along the line. One of the most important discoveries of the century, this is written in 1999, of the century, was the understanding that loading tissue facilitates the healing of muscle, bone, and ligament. It's like, wow, that was a statement of discovery in 1999. My coaches knew it back in 59. And I suspect that my great-great-great-great-great-great-grandfather knew it when he rolled his ankle pulling down trees and stuff. Of course you have to activate the muscles in and around the damaged site. It's just today we have an electronic way of doing it where I can be point specific. So you tell me it's your pitcher's shoulder, but it's their supraspinatus, or whatever. It's their deltoid, it's their trap. I can do just that so that I don't cause any stress or trauma or issue to the surrounding tissue. That's a wonderful invention, to have an electronic muscle activation device that is point specific. You tell me it's just my left lateral or just my left lateral quad. Okay, I could do just your left lateral quad. Or here's a really hard one with my NHL. I have over 2/3 of all the teams in the NHL use my product. One of their big problems is their psoas, their hip flexor. Well, how are you going to do the psoas and the iliacus? How are you going to facilitate recovery of that muscle? I understand ankle pumps, and I understand squeezing a ball. How are you going to do that? I can do it effortlessly. Effortlessly. And I can do it in setup in less than a minute. That's what matters, is that the invention allows us to do electronically what is very difficult in some cases to do by loading the tissue manually. You could do a hip flexor, by the way, on a bike with a toe clip and pull against it, and that would work. It's just, you got a bike,
Yeah.
you got a toe clip, you have time. I can do it on the bus, flying, or on the plane, flying back in the hotel room that night. You can put the pads on, and then they go back to the room and they do it themselves while they fall asleep. Well, this is a wonderful thing to have. So having electronic muscle stimulation, either with Mark Pro for non-clinical issues. So basically the rule is this. Mark Pro is an over-the-counter product. So if you're tired and sore, it's the right answer. If you're injured, well, then you have to go to a prescription product. Same technology, just you could go to a prescription product then, because companies like ours are regulated by the FDA, and we should be, by the way. I'm not anti-FDA. We shouldn't be practicing medicine without a license. So if you're hurt, if they're injured, you should be on a prescription product. If you're tired and sore, over-the-counter works beautifully. And by the way, the vast majority of people are tired and sore. They're not hurt. I mean, when you go in the athletic world, everyone's not hurt. Most people are tired and sore.
So we talked a lot about management of acute injuries. Where does Mark Pro serve a purpose in chronic injuries?
Again, I got to be careful because you're pushing the question into that injured category for an over-the-counter product. So let's just say muscle activation or electronic muscle activation.
Sure.
When you have a problem, it doesn't matter if it's acute or chronic. What you're trying to do is decongest the area and recapitalize the area around the damaged site. That's all this technology does. That's the purpose. And, of course, prevent the disuse atrophy.
Right.
So that's our purpose. I don't make you bigger, stronger, or prettier. I don't increase your range of motion. I don't make you more functional. I decongest the area, recapitalize the tissue around the damaged site, and prevent disuse atrophy. That's what I do. Now, on the back of that, though, sometimes you look at the problem and you say, well, if I were to do that, there wouldn't be many of the downstream problems, like the suffocation and killing of otherwise perfectly healthy cells that were not involved in the initial trauma, like the faulty scarring from the lack of motion and the disuse atrophy from the lack of use. So you skip all the downstream problems by dealing with the issue up front. So we have a great purpose with electronic muscle stimulation. It's a wonderful product. But just remember, it's only part of the solution, and it's a very specific part. Decongest the area, increase capillarity, prevent or retard disuse atrophy.
So Joe Scarcella online asked, what's the difference between the Mark Pro, the H-Wave, and other e-stim devices?
Well, the Mark Pro is an over-the-counter product. H-Wave is a prescription product. That's the difference. Other products on the market, there's probably 100. So it's too vague of a question to answer. But our technology is patented. So the H-Wave and the Mark Pro is patented technology. And that technology, we've protected vigorously. And other people don't do it the way that we do it. And they're unable to get the sustained muscle contraction without fatigue. And that's what we do. Now, other people, by the way, there are e-stims that can make it bigger, stronger, and prettier. And they do it. We don't. What we do is give a very significant contraction for a prolonged period of time without fatigue, but I don't make it bigger, stronger, or prettier. And that's the difference between us and the whole marketplace. In fact, my competitors will often say, well, they only do one thing. Okay, I'll take my one thing. I'm really, really good at it, and it's what matters most from my point of view. Decongesting the area, recapitalizing the tissue around the damaged site, and preventing disuse atrophy. I think that that's really important, and that's what we do. So that's our difference, our focus. Our clinical product, H-Wave, of course, is used with very complicated situations, back down to anything that's, diabetic ulcers, for example. There are articles published in peer-reviewed journals about H-Wave helping to close diabetic ulcers. Well, of course it closes a diabetic ulcer. It's just tissue damage. It doesn't matter what happened. It doesn't matter who you are or how it happened. All that matters is, are you activating the tissue in and around the damaged site? The muscles and the vessels stay in the same place. They don't move because, it's a diabetic ulcer. Well, no, he burned himself on a muffler. Well, what's the difference? It's tissue damage. It makes no difference. Or you have a shin splint. It's same muscles and vessels. The tissue damage, what's happened, how it happened, who it happened to, what is wrong, doesn't matter when you're talking about our technology. We're bringing in nourishment, flushing out waste, recapitalizing it around the damaged site, and preventing or retarding disuse atrophy. That's what we do. It doesn't matter what's wrong or how it happened. I'll give you my very favorite thing to say, actually, in this whole topic. I'll give you a question. If you want to guess, guess. If not, I'll just tell you the answer. Who do you think my most satisfied customer ever is? What do you think they did? What do you think they were physically doing? My most satisfied customer ever.
I'm going to guess that military guy you said he tore his pec off. That's going to be my guess.
I'm gonna guess it's your wife.
A concert flutist.
Oh wow.
Okay? So the mom hears him give a lecture. And she walks up and she says afterwards, do you think this would help my daughter? I'm thinking, well, is she a CrossFitter? What does your daughter do? And I said, so what's up? She said, well, it's her fingers and her forearms are constantly chronically cramping and it's preventing her from practicing. And I said, what'd she do? She said, well, she's a concert flutist. And I went, yeah. Now, how did I know? Because I have motocross guys whose forearms, they get forearm pump and cramping. So if I can handle that, I know I can do a flutist. So the mom calls me back in about, 3 weeks, 4 weeks, whatever it was. And she's crying on the phone. She's sobbing on the phone. And I went, hi. She said it worked. Of course it worked. It's just congestion. And this, you can see, if you're on camera, you can see playing the flute, what that would do to you if you practiced all the time. By the way, full scholarship to a major university to play the flute. So if you're out there and you're thinking, what? No.
It can happen.
Full scholarship to play the flute in the university's orchestra. I guess it's the orchestra. I think that's what they call it. I'm not quite sure if that's what it's called. But yeah, my most satisfied customer ever is a concert flutist. It's like, really? Well, same problem. It doesn't matter what made you tired and sore. It doesn't matter where it is. If it's your foot, your fingers, I don't care. It makes no difference to me where it is or what happened. Or who you are, or what sport you play. I don't care. When you have damaged tissue,